Gert, Marion, in your presentation you refer to online patient platforms. Is that what the platforms should be about? Objective, good information?
Absolutely, but it's even more fundamental and essential that we expose patients to these educational platforms. Only then it can have the right effect. And there the big opportunity lay in front of us. So we need to join forces to make patients aware that these solutions exist and then refer them to these solutions, where they will find unbiased and adequate information. Only then it can work.
Jean Bousquet, you talked already about physicians not knowing enough. What are the digital tools that we can use to improve the knowledge amongst GPs, experts?
Well, for me, we have an app with now 25,000 users. And I did the analysis myself of the database. It took me 2 weeks and a lot of headache. But at the end of that, I understood that what I was teaching to my students, and I think that in rhinitis I'm quite knowledgeable, was probably not what I should have done. First of all doctors prescribe regular treatment long term. Not a single patient does that, not even myself, who has written the guidelines. So I think that there is an enormous gap between what we're learning at school, what we're practicing, and what the patient does. And in fact, we need to be close to the patient because they are the users. And we are proposing things that we think they are excellent, but then it doesn't fit with what you need. So this app told me that at 71 years of age, I need to change the way I was seeing patients. And this is the major information I got. Change management. We need to change the management of all chronic diseases because adherence to treatment is extremely poor, and also because we are not discussing with the patients what they need.
So you learned that by using the app and doing research about it. Is that what every doctor should do?
No, we need to teach them, and this is why I have a big program now, which has been accepted by DG Santé, which is on the digital transformation of health using a patient-centered approach. Because we need to bring to patients the right information, then you can go to internet and get the right information. Then we need to tell the patient, well, this is what you have, this is what you have done, this is the way we can manage. And then give information as my rhinosinusitis coach does. So I think that there is a transformation of health which should be brought to the governments, because if the governments do not accept this, this is a tragedy. But there are several EU grants this year on the transformation of health using digital health.
Mm-hmm. Dr. Hellings?
Well, I couldn't agree more with what Jean and the others have said, but I would like to add here that there is also a mentality change amongst the physicians needed, where the patients are properly informed about the treatment options and where the patient is becoming an active partner in the decision-making process on the right treatment, leading us to the real-life implementation of precision medicine, where the patient is considered an active partner in the design of the therapeutic plan. And if you allow a patient to be an active partner of the plan, knowing all the consequences of the different treatment options, at the end, this will lead to a high adherence, a better level of control, and also cost economic benefits.